Pimples, or what some people call acne, are one of the most common skin diseases or conditions in the whole world. They not only affect the cosmetic beauty of your skin, your face, but also lowers someone's self-esteem and can also pose a danger to your health. Like in this question, someone asks that, "Hello Dr. Uthman, I have had pimples since my high school. I tried green tea and several other home remedies without improvement. What's wrong with me, and am I going to remain like this anyway? Please help me get rid of these things." And in this particular video, we would like to look at what causes acne, how you can treat them, prevention, plus the do's and don'ts of an acne. Don't go away.
Ask Dr. Uthman on Sawa Wall.
Hello our viewers, welcome to Ask Dr. Uthman YouTube channel. This is your channel where you learn medicine at the comfort of your living room. Find us on all our social media platforms. Ask any question of your choice, we shall be right there to answer you. And for those of you who want a private consultation or a private chat with a doctor, log into our website www.askdruthman.com and make an appointment. Today we are talking about pimples. Before we talk about pimples, we need to look at the skin. The skin contains pores, call them holes. They are like holes, and these holes contain a gland and a hair. The gland I'm talking about is the sebaceous gland. This gland releases or secretes oil onto the hair and finally onto the skin. This oil is actually the one that makes your skin moist, soft, and smooth. So our skin requires this oil. What happens for someone to get a pimple? I'm now looking at the causes of pimples. There is blockade of these pores. What I'm talking about is blockage or blocking the holes that are supposed to secrete the oil. Blockade can be caused by three things. Number one, excessive oil production. Two, excessive bacteria onto your skin, and lastly, the dead skin. So in our summary, we can see that pimples are caused by number one, excessive bacteria on your skin, excessive oil production, and lastly, excessive dead skin onto your skin. So let's look at the risk factors for developing pimples. These are the factors of which, if you have them, they can expose you to getting pimples. Number one, hormonal changes. If you are in that condition that involves a lot of hormonal interplay, you'll be exposed to getting pimples. For example, people in their puberty stage. Actually, most people develop pimples during the puberty stage, and some of them, if they are left untreated, they continue up to their adulthood. And if you treat them, some of them really get fine. Other people develop pimples during pregnancy. When they get pregnant, they develop those pimples because of the hormonal interplay that happens during that period. And other people develop pimples during menstruation. Same thing that happens in puberty, pregnancy, and so on. Then other people who are exposed to getting pimples are people that eat foods or diet rich in high sugars. Example are bread and chips. People who eat a lot of chips are also prone to getting pimples. Therefore, if you really want to get rid of pimples, one of the steps is to reduce intake of such foods. Some pimples are hereditary. By hereditary, I mean they pass through families. You find the whole family, the whole generation has pimples, and those are very dangerous. And other people get pimples because of anxiety disorders. What do I mean? When people undergo stressful conditions, they lead to production of those hormones that can lead to excessive production of oils, and then pimples will develop. So how can we treat pimples? Before you even look at treating that pimple you've developed today, I want you to look at this point very critically. Number one, never scratch your pimple. I repeat, never scratch, never pop, never pinch or even touch your pimple, except if you're applying the medicine. Why? Because the moment you scratch it, you pop it or pinch it, you irritate it and cause inflammation, which will lead to the swelling of your face, swelling of that part where the pimple is. Therefore, even if we end here, never scratch your pimple. So what is the goal of treatment? When we are treating you these pimples, we look at number 1, reducing excessive oil production into your body. Number 2, reducing the swelling, because some people develop pimples and then swell that particular area or even swell the whole of that structure. So therefore, we look at reducing the swelling in that area, and number 3, treating the infection if any. So the treatments available are in topical formulations and tablets which can be swallowed. Number 1 of those are the retinoid drugs. Retinoid drugs are those drugs that contain retinoic acid. And these drugs are in formulations of gels, lotions, and creams. An example of them is adapalene. So when you go to your pharmacy, ask for a drug or a cream that contains retinoic acid, or you can just read yourself on that cream the contents, and if you find retinoic acid, just buy that cream. So how are you going to use this cream? Apply it at least 3 times in a week. By 3 times in a week, I mean if you apply it today, don't apply it the other day, but apply it the following day. So 3 times in a week for the first week, and then the skin will have gotten used to the cream or to the drug. Now you can apply it daily for the following weeks until the pimples clear. Secondly are the antibiotics. Commonly the antibiotics we use are clindamycin, erythromycin, and doxycycline. When we are using these antibiotics, we combine them with a drug called benzyl peroxide. This drug helps in reducing the swelling of this pimple. And therefore, when you apply these drugs, actually when we are giving you drugs or when you're taking drugs for pimples, you don't take just a drug in isolation. So you combine these drugs, the retinoid and an antibiotic, all plus a drug called azelaic acid. Azelaic acid is also available in creams and gels. So if you go to your pharmacy, ask for a cream or a gel called azelaic acid. It can be in different brands, but as long as you find a brand which contains 20% of azelaic acid, that is the best brand or the best drug to take. And azelaic acid is the best treatment to give for pregnant women, because the other retinoids and then the antibiotics, the doxycyclines of this world we've talked about, are contraindicated, or they are not supposed to be taken when someone is breastfeeding or when you are pregnant, because they can pass through those vessels and then reach the baby. Therefore, the best drug to give when you are pregnant or when you're breastfeeding is azelaic acid, which is available in creams. And I told you it should be a 20%. Another drug can be dapsone. As long as you find a tube or a cream that contains 5% dapsone, buy that cream, use it. It will also reduce the swelling. And some other drugs that are available for preventing or stopping or treating this acne are the oral contraceptive pills. The oral contraceptive pills are the common family planning pills we use. So if you don't have a problem with family planning, you can use these drugs. They can also help in the other way around. But if you want to have children and you don't have any program of stopping or having a space, then you not use these oral contraceptive pills. Then another drug, and this is the last drug I'm giving you, are the anti-androgen drugs. Anti-androgen drugs, for example, the spironolactones of this world. This is the same drug we also use in heart failure, in liver failures. People with liver failures that have also gotten an effect or a complication of swelling of the abdomen. I think you've seen very many people with liver diseases that have swollen or that have swollen abdomen. We use the same drug to trap or to reduce the fluids that are in the abdomen. So this same drug can also be used to remove those fluids in the pimple. So the treatment we've seen above can be applied from home, but there are some medications or therapies that can only be applied from the hospitals, and these are called hospital-based therapies. They include drainage and extraction, chemical peel, steroid injections, and light therapies. These are procedures which can only be done or can be worked upon in the hospital. Therefore, if you've applied or if you've tried the above, the topicals, the tablets, and they have failed, you can go to the hospital and try those therapies, though I won't expound so much on them. But the most important thing is knowing how you can prevent or you can avoid getting pimples or acne. Number one, this goes mainly to ladies out there. Avoid oil-based makeup products. I understand that makeup is part and parcel with women beauty. However, when you're choosing your makeup products, make sure that you choose those makeups that have less oil or that have completely no oil. Those will work for you and they will not be able to cause acne or pimples on your skin. Another issue which everyone needs to pay attention to is sleeping with makeup. It's a wonder that some women sleep with their makeups. I've watched some Nigerian movies and you find, I'm sorry for my Nigerian followers, there are some Nigerian movies I've watched and you find that someone sleeps with a makeup or there is a breakfast in the bed and a lady wakes up with makeup. So this is something which is supposed to be avoided. When you're going to sleep, please wear off your makeup or clean off your makeup so that you don't provide a good environment for pimples or acne to develop. Another thing is to stay hydrated. Take a lot of water, take plenty of water. 3 liters a day can do for you. Those are 6 cups or 6 mugs of water. But people who get dehydrated, you know, dehydration causes stimulation of hormones that lead to production of oils. And when excess oils are produced, of course, you know what happens is the eruption of pimples or what we call acne. Then something else which is also not easy to avoid is stress. But try as much as possible to avoid stress because it's one of the factors that stimulate the growth of pimples. And another issue, the last one, which is also very, very important, is avoid junks. Junk foods, we shall talk about them several times. People like eating chips, people like eating junks, and those are one of the foods that expose you to getting pimples. Then something else we need to understand, when you have a pimple, there are signs you should look at that should force you to go to the hospital. If you see any of these signs, it means you should rush to the hospital for medical attention. Number one, if you get difficulty in breathing, if you faint, if there is swelling of the face, the lips, and the tongue. These signs should warrant you to go and seek for medical attention because they can cause some emergency. And also another sign I've not talked about is throat tightness. Sometimes pimples can cause tightness of the throat and someone is not able to swallow, someone is not able to breathe very well, they may end up fainting and so on. You should go to the hospital for medical attention. In my conclusion, I would like to demystify the myth and misconception about pimples or acne. There are some people who link acne to hygiene. They go on and say people who are dirty, people who don't bathe, people who put on dirty clothes are exposed or are at risk of getting pimples. There are also those that claim that eating chocolate or chocolate-based products can cause acne. This is not right. It is not scientifically proven that those two items can cause acne or can cause pimples. Thank you very much for watching Ask Dr. Uthman YouTube channel, and if you're a new person here, please don't leave without subscribing. Press the notification button so that we can notify you of any videos we upload. And if you want a private chat, you want a private consultation with me, you can log into our website www.askdruthman.com and make an appointment. We shall be chatting together.
Dr. Uthman. Ask Dr. Uthman.
Have you ever imagined yourself having twins? Actually, to many people, it's a very big blessing to have twins. In this particular video, we would like to look at the factors that can contribute for you to have twins and if there is anything you can do in order to have twins. I would like to go for family planning. I wanted this thing they put in the arm, but I hear people say it can move and disappear in the body. Is it true? To our viewers, I think Bridget is trying to mean an implant. And it is not true that an implant can move and disappear in the body. An implant is a rod, is a small rod, or you can call it a stick. It's a small stick of around 2 centimeters. It is put underneath, just underneath the skin, below the skin of your arm. And once you put it there, it can help you not to conceive if you're not yet ready to have a child. Please, doctor, which day is best to conceive a baby boy? Another one is Alabera's Kitchen. She says, hi doctor, which day can I conceive a baby boy? And lastly, Rukundo from WhatsApp says, what about if you want to have a baby girl? Thanks. There are several of these questions in my inbox asking about child gender, child sex. I must be very sincere with you that there is only one method that is scientifically proved to be 100% correct that can allow you select the sex of the child you want.